This video will go over some general best practice guidelines to keep in mind when you are completing your medication pass. Okay. Here are just a handful of suggested supplies for the med carts. Blood pressure cuff, tissues, souffle cups, pen, spoons, applesauce, pill crusher, paper. If you're using an electronic MARS system, it'll be a laptop to be able to utilize that. If you're using paper MARS, that's going to be a binder with categorized paper MARS. Best practice guidelines for hygiene. Washing your hands. Make sure you're washing your hands correctly for at least 20 seconds prior to the medication pass, in between each resident, as well as after administering any kind of topical or any medications that come in contact with the mucous membranes, and after you remove gloves. Again, make sure that you're washing for at least 20 seconds. And always, always pour the medication into a medication cup. Don't pop pills out of blister packs or comp packs or the automated packaging straight into your hand or straight into the resident's hand. Ensure that it is always going into a medication cup to then be taken. You want to ensure when you are starting your med pass that you are doing everything you can to avoid interruptions. Here's a small study from Sydney, Australia that just essentially points out the implications of each interruption and how that causes an increase in failures and errors. So you're wanting to just ensure that you are taking extra time to avoid any kind of interruptions, any kind of phone calls or being pulled away if at all possible. Timing is very important when it comes to medication passes. Each facility runs a little bit differently. It can be scheduled, in an hourly or an hour block timing. It can be upon rising, prior to bed. So just follow along with however your facility is set up and your facility policies outline. But we're just wanting to make sure that you're staying within 1 hour of that scheduled administration time. You don't want to, give something 3 hours after the person has woken if it's supposed to be upon rising. You want to make sure that that is being done in a very timely manner. Also be very aware of those residents that have mealtime dosing. So that can be before meals, with meals, or after meals. And just ensure that, if Mrs. Jones has to take this medication before she eats, that she's not going to lunch or breakfast, dinner, eating, and then returning before she is receiving that dose. There are 6 rights for medication administration. That's the right to having the right drug, the right resident, the right dose, the right time, the right route, and the right documentation. And just ensure that you are single, double, triple checking everything. There are specific routes for the different administration of medications. There's tablets, capsules, liquids, oral inhalers, nasal sprays, nasal inhalers, ophthalmic, otic, vaginal, rectal, injection. So just ensure that you are choosing the correct administration. In regards to safety and security, always ensure that you are locking your med cart. Even if you feel you're just going to be away for a moment, if you're in the middle of med pass and you're going to be going back and forth and back and forth, ensure that you're still locking it. You don't have complete control over the people that walk by, the intentions of those people that walk by, so just ensure that it is always locked when you are not in it and actively using it. Don't leave any kind of medications on top of that med cart, and then always make sure that you're checking expiration dates. All blister cards are written with an expiration date of 1 year from the date of package, unless that medication bottle has a sooner expiration date. So just ensure that you're always staying on top of the expiration dates of all the medications in your cart. Make sure that you're monitoring the medication pass. So when you give Mr. or Mrs. Jones their medication, that you're observing them swallow that medication. You are observing any kind of therapeutic or side effects. And then know that that patient does have the right to refuse their medication. It's just our job as med passers to offer that medication. If they refuse it, you're going to educate them on why it's best for them to take that and why the doctor's prescribed it within your competency and within your right of practice, and then reoffer that medication to them. If they still refuse, document that effort, and then you're going to continue that cycle again when it comes time to pass that medication at the next time slot.